Thanks, Michaela. Now that we've heard about the current problems associated with accessing healthcare in impoverished communities and what the local community is currently doing to address these problems, I will now inform you about potential solutions. One potential solution is locating clinics and hospitals in areas with these high rates of poverty. According to the New York Times, half of hospitals in cities have closed in the past 30 years, and of those hospitals that have closed, they have been in mostly impoverished areas, which has further decreased access to healthcare for people living in these communities. This is important because many people living in poverty do not have a car and rely on public transportation or getting a ride from somebody that does have a car to access a clinic or a hospital that is far away. So by locating a clinic or hospital in where they live in the first place, they would not have to deal with this burden. The map below shows rates of poverty in Lafayette and West Lafayette, with areas in dark purple showing high rates of poverty. And the map above that shows the location of clinics and hospitals in the area. As you can see, there is only one hospital located near these areas of high poverty, meaning if that one hospital did not have the services somebody needed or was too busy, somebody would have to travel a much further distance to get the care they needed, which may not be possible for many of these people. If you cannot build a clinic or hospital in the area, then the next best thing you can do is bring the hospital to them by using something called a mobile clinic. According to NPR, the Family Van, which is a mobile clinic located in Boston, significantly reduced local healthcare costs. The average blood pressure of patients decreased by 40% and amounted to $1.6 million worth of savings directly to the patients because they no longer had to purchase prescription drugs to reduce their blood pressure or visit the local ER for blood pressure-related concerns. One major advantage of mobile clinics is accessibility. By being able to drive a clinic directly to where the people need it, they no longer have to worry about traveling to a faraway clinic or hospital. Another benefit is being able to offer comprehensive care. Because the clinic is mobile, you can bring in specialists from other areas that normally do not serve there and offer services that local doctors do not offer. And on top of that, mobile clinics can be shared among communities, which helps reduce costs of running and maintaining the clinic to each individual community. One important but often overlooked problem is effective communication between healthcare providers and their patients. People living in poverty often have low rates of health literacy, which makes it more difficult for healthcare providers to effectively communicate with their patients. According to the Journal of Medical Research, narrated animations and other visual aids are most effective to communicate complex health information to patients with low health literacy. For example, if you had to inform a patient that they had lung cancer located on the bronchial tubes of their lungs, they might not understand what a bronchial tube is. But if you're able to show them the picture located in the bottom left of my screen, they would be able to visualize what a bronchial tube is and where it's located in their body. As you can see, improving access to healthcare in impoverished communities does not have one solution, but many solutions working together. By supporting clinics located in these areas and mobile clinics that travel and serve this community, either through monetary donations or through volunteering, you can help improve the health and lives of people living in poverty in the greater Lafayette area.